We are live. We are live. Welcome to Medical Monday, where we talk about celebrity health and all of the hot health topics in the headlines. I am Dr. Frita, and I am very excited to bring you another great evidence-based show. So make sure you go ahead and give us a like, give us a follow, because I'm giving you evidence-based information that you'll be able to use and share with loved ones. Let's start off with my favorite little game, myth versus fact. So I love this game, don't love this news. We lost the actor Diane Keaton at the age of 79, now reportedly to pneumonia. So as always, we'll take the health that's in the headlines and make it something that we can all learn from. So I'll give you some myth versus fact statements about pneumonia so we can learn. Then we'll get into our weekly dose, where I'll give you a fresh take on medicine you simply can't get anywhere else. We'll open up talking about more sad news because we lost the Grammy Award winning neo soul R&B songwriter phenomenon D'Angelo at the age of 51 to pancreatic cancer. So we'll talk about signs, symptoms, risk factors, diagnosis, treatment when it comes to pancreatic cancer. And then this next story makes me mad, but this is what it is. We have yet another measles outbreak. Don't y'all know that we eradicated the measles in the United States back in 2000? Well, now we have an outbreak. Over 150 school-aged children are in quarantine because of the measles. And guess what? The kids under quarantine, these over 150 kids, are unvaccinated, likely largely due to misinformation. And so I'll talk to you about measles because you need to respect the measles. It is a bad mamma jamma, one of the most infectious diseases that we have. And yes, people can lose their lives from the measles. So we'll talk about the measles. Then we'll talk about Selma Blair, the actress Selma Blair, who's been very open about her living with multiple sclerosis. Well, she shares that she actually, in hindsight, had signs and symptoms as a teenager, but these signs and symptoms were overlooked. And so we'll talk about how oftentimes patients can be gaslit, specifically female patients. Okay, their symptoms can be minimized to just them being on their cycle. We'll get into it, but we'll talk about Selma Blair, and I'll give you some information on multiple sclerosis. And then we'll talk about Shonda Rimes. Do you know that she thought that she was going to be out of here in 10 years? She thought she was on her way to be unalive. We'll talk about food addiction and her health reset. And then, if we have time, we'll talk about something very exciting. I talk about a major life-threatening side effect from a commonly used blood pressure medication. Spoiler alert, it can make your lips swell all over your face. So if we have time, we'll talk about that. Meanwhile, give us a like, get your pens and pencils ready. I'm going to ask you questions. You can ask me questions. I'm Dr. Frita. This is Medical Monday. Let's get this thing started. Hello, hello. I'm Dr. Frita. Welcome to Medical Monday. Medical Monday. We talk about celebrity health and all of the hot health topics in the headlines. I don't do this thing alone. I don't do it alone. So please welcome my office manager and co-host, Miss Shador, to the stage. Come on to the front of the stage, Shador. How are you doing?
Hey, good. How are you?
Good. I'm loving this hair. You done pressed out all that old long natural hair. I know whoever did it, they're somewhere in recovery from muscle tension, having to go through all that thick hair. I like it.
Thank you. Thank you.
All right. You had a good weekend?
Yeah, I did have a good weekend. How about yours?
It was good. It was good.
Last weekend here.
Yeah. Well, you know, I came back, of course, from the conference.
Oh, yeah,
you know,
the conference.
That was a big part. And for everyone watching, for those of you who don't know, I am medical director for a nonprofit dialysis unit. And we had our conference, which was very exciting. We had it in Florida. And we talked about some of the things affecting our dialysis patients, like cuts that are coming to Medicare, Medicaid from the big fill in the blank with your descriptor bill. We talked about home dialysis. We talked about ways to try to keep people off of dialysis. We talk about transplantation, all types of things. Just a really wonderful conference, great speakers. So I had a very good time and very proud to be the medical director for this dialysis unit, DCI. And then I had to rush back in town a little bit early, Shador, because I got a chance to speak at my aunt's church for Think Pink. They had a
Oh,
breast cancer awareness. Yeah. And they recognized my aunt as a survivor. And, you know, my mom is one of 16 siblings. There are 10 girls, 6 boys. And at this point, 6 of the sisters have been diagnosed with breast cancer. And so
no.
we just talked about awareness, and we talked about the fact that Black women are 40% more likely to pass away from breast cancer than other ethnic groups. We talked about early detection, and it was just a good, feel good ceremony. So I had a great weekend and week. But we had some sad news in this past week, of course. And so we're going to address it. We're going to address it. Let's start off with talking about Diane Keaton. But first, who was the first person in the chat, Shador?
First person in the chat today was Miss Marina. She says, "Good morning, Dr. Frita and Shador."
Good morning, Miss Marina. Thank you for coming and joining and being first.
Absolutely. And we have a new member, Miss Patricia. Hello, welcome.
Welcome, Miss Patricia. Thank you so much for joining the membership. Listen, I did a members only video for you, Miss Patricia, sometime this weekend. When did I do it? It might have been on Saturday. So that's what I do. I give you members only videos that the general public does not see. And then we have our members only live Q&A every month, the last Monday of every month. And so instead of me getting up here and boop, 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 talking, this gives you the chance to ask me your questions for the entire session. You can come on stage. We'll drop a link for that, and you can really take advantage. Because for those of you who are new to me, I am Dr. Frita. I'm an MD. I'm a medical doctor. I've been quadruple board certified. I'm a board certified nephrologist, meaning I'm a board certified kidney doctor and high blood pressure doctor. I have also been board certified in internal medicine, pediatrics, obesity medicine. So I love to learn. I love to read. I read medical journals every single day. And more importantly, I love to share. And thank you to those of you who are here on YouTube, where we have over 900,000 subscribers. We are now marching toward 1 million. So if you have not already, please subscribe. We have hundreds and hundreds of videos of evidence-based medicine, and also get a chance to do a lot of media medicine. In fact, tomorrow I'll be back on a Washington, D.C. show, their local Fox 5, giving more medical information. I've been on the Don Lemon show a few times, the national show, News Nation, the Emmy Award-winning Paternity Court. I've been the medical expert on there. So if you go to my different playlists right here on YouTube, I guarantee you will learn, you will laugh, you'll have a good time, and it's with evidence-based medicine. So thank you, and thank you, Ms. Patricia, for becoming a member. Anyone else who wants to be a member, come on, join the party, por favor. You can click the link in the description or go to my one-stop shop, drfrita.com. That you can get it all from drfrita.com. All right, Shador, shall we get this thing moving? Let's open up with a clip on Diane Keaton. She really was a remarkable actor. I really liked her in, oh my gosh, the Godfather series, okay, where she played Al Pacino's character's wife. She's done a lot of comedic acting, and she's just good. She's just talented, and she seemed to be pretty non-problematic, and just kind of a positive figure with real talent. So let's play that clip, and then we'll get into myth versus fact when it comes to pneumonia.
This morning, after Diane Keaton's death shocked Hollywood, the cause of death for the legendary actress is coming to light. In a statement shared exclusively with People, Keaton's family revealing that the star, who was 79 years old, passed away from pneumonia, adding they're very grateful for the extraordinary messages of love and support they have received these past few days. The Oscar winner had been a fixture on the screen for decades.
Oh, well, la-di-da, la-di-da, la-la, yeah.
Still making movies into her 70s, but mostly out of the public eye recently. Still, her death came as a surprise to her many fans, her family not revealing more about Keaton's illness. But Keaton's friend, songwriter Carol Bayer Sager, recently reflecting on her last visit with the actress in an exclusive interview with People, saying, "I saw her 2 or 3 weeks ago, and she was very thin. She had lost so much weight," adding, "I was kind of stunned." Since Keaton's death over the weekend, tributes have been pouring in, honoring the Oscar-winning actress. Filmmaker Nancy Meyers also honoring her longtime friend and frequent collaborator, calling her fearless and born to be a movie star, adding, "As a filmmaker, I've lost a connection with an actress that one can only dream of."
All right. So rest in peace, Diane Keaton. Reportedly, she passed away with pneumonia. And I know there's a lot of kind of mystery around pneumonia. So let's go ahead and let's put up our first myth versus fact statement. And for those of you who are new to us, this is your time to participate. So we'll give you a statement, and I want you to put if you think it's a myth or a fact, and then we'll talk about it. All right, Shador, what's our myth versus fact statement number one?
Number one, you can't catch pneumonia from someone, but you can catch the germs that cause it.
Okay, so you cannot catch pneumonia from someone, but you can catch the germs that cause pneumonia. Put an M1 if that's a myth. Put an M2 if that's a fact. You can't catch pneumonia, but you can catch the germs that cause pneumonia. M1 if that's a myth, F1 if that's a fact. All right, myth versus fact statement number two. And hey, I know y'all are over there, IG, Facebook, and hey to everybody who's in the replay crew. I want y'all to participate also. Let's put up statement number two, please.
Mm-hmm. In older adults, confusion or a sudden change in mental state can be a primary sign of pneumonia, even without a cough.
Put an M2 if this is a myth. Can you just be sitting here with confusion and other symptoms, not even coughing? Or an F2 if that's a fact. All right, pencils down, pencils down. All right, do we have any takers, Shador?
Absolutely, we do. I think we got a mixed bag.
Ooh, I love a mixed bag.
All right, back to statement one. You cannot catch pneumonia from someone, but you can catch the germs that cause it.
Okay.
We have Marina says a myth.
A myth. Okay, so Marina, you're thinking you actually can catch pneumonia from someone, okay?
Aileen says a fact.
Ooh, Aileen. All right, you say it's a fact.
Pamela says a myth.
A myth. So you think you can catch pneumonia from someone else?
I can see clearly says it is a fact.
I can see clearly. Hi. Okay, you say it's a fact. This is a mixed bag, Shador. I love it when we have a mixed bag because that means that there are points of learning. Okay, good.
Yeah. Joseph says it is a fact.
It's a fact that you
And
can only
Lisa.
catch the germs. Okay.
Lisa says a myth.
Lisa says a myth. Oh, thank y'all for participating. This is good. This is like right down the middle. All right. Anyone else?
Yeah, a little bit of activity on IG going on.
Hey,
This
IG. Thank y'all. Who is this?
Hey, Zaymon.
Hey, Zaymon.
He said it's a fact.
A fact. Okay. This is so curious. I didn't think it would be split like this.
Berlin also says a fact.
Oh, okay. And IG, check me out, IG. I do have a lot for you over there today, over the weekend. Oh, even during my conference. See, y'all, I was working while I was supposed to be at my conference. I did a few shorts. I definitely did a short on the measles outbreak. I did a short on angioedema, one of the side effects of a common blood pressure medication. Oh, and I just posted yesterday from the National Kidney Foundation, the Atlanta Kidney Walk. I'm a board member of the Atlanta National Kidney Foundation. We had our kidney walk. We surpassed our goal of raising $125,000 to raise awareness when it comes to kidney disease. You'll see when we check out that reel, you'll see my daughter in the pink who's trying to be taller than me, my 15-year-old, but she was out there doing her volunteering. So she got a lot of good volunteer hours in, plus fun. For our warm-up, y'all know we dance. We have a radio personality, Maria, who's leading the dances. Anyway, I have that for you over there on IG. So thank you for joining. All right. So is this a myth or is this a fact? Okay. You cannot actually get pneumonia from someone, but you can get the germs that cause pneumonia. This is a fact. It's a fact. It's a fact that we had a mixed bag. Okay, so here is the deal, because I know y'all are looking at me like, what? Because we were split pretty much down the middle. So pneumonia is an inflammation in your lung cells and your lung tissue, right? And so you get an infection. It can be from bacteria, from viruses, from fungi, and it can cause inflammation, mucus production. It can, cause a blockage or an obstruction to some of your breathing. All of your air sacs can be filled with mucus and infection. But here's the thing. You can't actually pass the pneumonia from one person to the other. It's not a lung inflammation that you pass, but it is the germs that you pass. And then that person might develop pneumonia, they might not. Case in point, the most common bacterium that will cause pneumonia is Streptococcus pneumonia, right? And yes, it can cause pneumonia, but it can also cause ear infections. It can cause sinus infections. And so I might have pneumonia and I might cough and spread the bacteria to you through a respiratory droplet, but I can't pass my pneumonia to you. Once you get the bacteria in your body, you might get an ear infection. You might get a sinus infection. And so the point is, it's the germs that are being passed, not actually the disease process of pneumonia. Okay. And this really happens a lot when you have kids. They might be young, healthy kids running around, coughing, but playing and feeling perfectly fine. They might be passing bacteria to you, okay? Haemophilus influenza. They might be passing Mycoplasma pneumoniae. They might be passing Streptococcus pneumonia to you. But the kids are really healthy, great immune system, like 5-year-olds, 8-year-olds, they're fine. But they go home and they cough on their grandma. The grandma has pneumonia, okay? So they're passing the germs that cause pneumonia, but the actual infection of a lung infection to another person is not what's passed. You're not passing lung infection and causing a lung infection. You're passing the germ. So I hope that makes sense. And so just while we're talking about it, so we've got, the most common Streptococcus pneumonia, Haemophilus influenza can cause it. Some viruses, flu, influenza, that virus can cause pneumonia. Okay. It commonly doesn't cause it, but certain people are at higher risk for pneumonia, such as being an older person, older than the age of 65. And we know that Diane Keaton passed away at 79. If you are older than 65 or younger than the age of 2, you're considered to be at high risk. If you are a pregnant mom, you're at high risk. You do have some immune compromise when you're pregnant, okay? So you can be at high risk if you're pregnant. Certainly if you have had a transplant and you're on immunosuppressant drugs that push your immune system down so you don't reject the transplant, you're at increased risk for pneumonia. If you have certain infections that affect your immune system, like HIV, especially if you have a very high viral load and a low CD4 count, okay, then you can be at increased risk for pneumonia for sure. And so these are the categories of people who are more likely to get pneumonia. Other healthy people, sure, they can get pneumonia, but very often they might get a little, they might get exposed to the bacteria and they just have a little cough, a little ear infection, a little sinus, or nothing, but they can still pass the germs to someone who's more vulnerable, and that person can develop pneumonia. So yeah, that's a good one. All right, let's do myth versus fact statement number 2, Shador.
In older adults, confusion or a sudden change in mental state can be a primary sign of pneumonia, even without a cough.
I'm curious to see what you say about this one. Okay, who do we have, Shador?
All right, we got a mixed bag on this one as well, I believe.
Ooh, we mixing it up.
Cat Monster says myth.
Hey, Cat Monster, you think it's a myth? So you don't think that it's going to be just having like altered mental status, things of that nature? You think it's going to be a cough or some type of a respiratory symptom for sure? Okay.
Just like that, agrees that it's a myth.
Just like that. So you're not buying it. You're thinking if it's pneumonia, it's a lung infection, you're not fixing just present with altered mental status or some crazy stuff like that. All right, just like that.
Tony disagrees. Tony says fact.
How dare you, Tony? So you think that with elderly people, they can present with a lung infection without specific lung symptoms? Tony. All right, we'll see what's going on.
Lisa J also says fact.
All right, Lisa J. All right.
Mun says myth.
You think it's a myth? All right.
Purple Onion says a fact.
Welcome, Purple Onion. Y'all better listen to Purple Onion now.
And over on IG, Got a Brand New Bag says a myth.
Got a brand new bag. Papa got a brand new. Okay. All right. Thank you for joining us over there on IG.
Zaymon says a fact.
Zaymon says it's a fact.
Big E says myth.
Who says myth?
Big E.
Big E. All right. And it's over on IG. Thank y'all for participating. All right. Now, this one, I can tell y'all firsthand because I've seen it so many times. It's a fact. It's a fact. Let me tell you something. If you're not careful as a physician, as a healthcare provider, if you don't think out of the box, elderly people can mess you up every time with the way that they present. So absolutely, even something that is inflammation of the lungs, where you think they should be coughing and sneezing and short of breath, an elderly person or someone who's over 65 can present with things like altered mental status, confusion, and if you're not thinking, you could miss pneumonia. Okay. And it's not just pneumonia that can present like that. I've had patients with urinary tract infections who present with total confusion. I've had it over the years. And Shador, we're not going to mention names, of course, but you might remember one of our patients in his early 90s at the time, his girlfriend, because yeah, honey, he always had a girlfriend. They went to the ER, and he's someone who's very sharp. Okay. No signs of dementia, nothing, just really, really sharp. But he was confused. There was nothing obvious, but then they realized he had a urinary tract infection. So the point is, when you're dealing with elderly people and all of a sudden they have confusion, open your mind. Don't just think brain. Think, could they have an infection? Because yes, elderly people can present as confusion, altered mental status, and it can be pneumonia, even if they don't have a cough. I know that's odd, but take it to the bank. So even if you're not a healthcare provider and you're watching this, if you have, elderly parents, if your husband is old, because the ladies, we don't get old, or if you just, you're around people who are elderly, just keep that in mind. If they have confusion, say, take them to the doctor, have them checked out for infection, including pneumonia. Yeah. All right. So that's a good one. That was good participation. Good participation. For those of you who got that one, y'all need to come on to the front of the class, because I know that was a hard one. All right.
Dr. Frita, we have want to shout out a new member, Miss Rachel.
Thank you for joining. Thank you for coming to the membership. Listen, check it out. I did some members only videos for you this past weekend. Plus now you have a whole slew you can catch up on. Members only. And then we have a live Q&A coming up. Welcome. Oh, we got a comment?
Question, but I can get some clarification and then we can get to her question at the end. She says, what about if you have respiratory issues like asthma and wheezing? Can you just clarify it pertaining to exactly what you mean about respiratory issues like asthma and wheezing?
Okay.
So I'm asking her what's the exact question. So her question is, what about if you have respiratory issues like asthma and wheezing? So can you be a little more direct, Ms. Rachel, on your question, please?
Okay. And while she's clarifying, I'll kind of start saying what I'm thinking, and let me know if I hit on what you're asking. So I talked about the different people who have increased risk for pneumonia. If you're someone with chronic lung disease like asthma or like COPD or like bronchitis, then yes, you could also be at an increased risk for pneumonia. Now, we know that asthma symptoms, if you're having an asthma exacerbation, then you can have wheezing, or especially if you're a child, you might not wheeze, you might present with a cough. And then as you get into respiratory distress, if you have asthma, you might get accessory muscle use, meaning flaring nostrils. You might see the muscles in your neck go in and out. If you've ever had a kid who has asthma and having an exacerbation, that's pretty serious. It's pretty scary. Nostrils flaring, or their stomachs might move up and down. You might see their ribs. Okay. This is a sign of respiratory distress. And so we know that it can happen in asthma. So yes, you can get wheezing, but you can also get a cough and other things as a sign of distress. And if you are a person who has asthma, then yes, you already have an inflammation in your lungs with asthma, not from infection. You already have mucus buildup in your lungs from asthma, but this could put you at increased risk for pneumonia. Now, if you get pneumonia, then the difference is going to be that instead of you just having these respiratory issues, the inflammation in your lungs, the mucus, the wheezing, you may develop a fever. Okay. That's going to be your sign of infection. You can get a high fever, like up to 105. You can also, certainly if the pneumonia makes you septic, like if it makes your body have an abnormal response and you get an overwhelming reaction, then you might get fever and you can get other organ failure. And if you're at very high risk, it can be to the point where you get respiratory failure and you require a breathing tube. So basically, asthma symptoms, you're not typically going to have signs of infection. You're not going to have the fever, and your total body is not going to be sick or septic. But definitely when you have pneumonia, especially if you're a person at high risk, it can lead to sepsis, septic shock, respiratory failure, things of that nature. Yeah. Did she come back, Ms. Rachel, for any clarification?
Yeah, I think you hit it on the nail. She said,
okay, good.
Yep. And she says, does that help? Does the pneumonia vaccine help prevent getting pneumonia?
Yes, and I'm glad you brought that up. Absolutely. Consult with your doctor. But the pneumonia vaccine actually covers a lot of the common pathogens, a lot of the bugs, the germs that cause pneumonia, and it can help to prevent you from getting pneumonia. And certainly when you're in the high risk category, it can help prevent you from passing away from pneumonia. Absolutely. And here I go with HIPAA again. My parents are up to date on their pneumonia vaccines. Consult with your doctor. Very good question. Yes, that's the whole point of the pneumonia vaccine. It can help prevent you from getting it because millions of people get pneumonia each year, and approximately 55,000 people in the United States pass away from pneumonia. Okay. But imagine doing something like getting the pneumonia vaccine can help to prevent you. And of course, when we're in seasons like cold and flu season, doing things like frequent hand washing, putting on a mask, covering your mouth if you sneeze with your elbow. Don't be covering it with your hand and then come and trying to shake somebody's hand. Doing things to really try to, keep your area clean, keep yourself, try to prevent yourself from getting infections. These are other ways to prevent pneumonia. So very good. Very good. And remember, bacterial pneumonia, yes, that's the most common, and it tends to make people the sickest. You can get viral pneumonia. A lot of people will get like mycoplasma pneumonia. That is a walking pneumonia. If you get a viral pneumonia, oftentimes you'll get over it on your own, like it'll be self-limited if you're not someone who's immunocompromised. Fungal pneumonias, those can make you very sick. And then you can have complications from pneumonia, like you can get a lung abscess, from pneumonia, and you can get fluid in your chest cavity. You can get pleural effusions from it. And of course, again, you can get septic shock. And so as far as diagnosis, consult with your doctor. They'll do a history and a physical, a chest x-ray, okay, which can reveal. Normally the lungs on chest x-ray look nice and kind of see-through clear. They look black on those chest x-rays. If you have pneumonia, you have this mucus collection, inflammation, pus, it'll look white or light gray on the x-ray. And then sometimes they'll have to do a sputum, like phlegm, where you cough up and they take a sample to find out what the organism is. And if it's bacteria, you treat it with antibiotics, viral, antivirals, and, with fungus, of course, antifungals. And sometimes, again, it can be self-limited and you might not require treatment other than just supportive care like Tylenol, fluids, things of that nature. So, yeah, but I'm glad you mentioned pneumonia vaccine. It's also flu season. Okay. It's recommended flu before boo. Get your flu vaccine before Halloween, flu before boo. Consult with your doctor. I got my flu vaccine. Y'all, President Donald J. Trump got his flu vaccine despite all this kind of anti-vax talk that's going on. But consult with your doctor. He also got his COVID vaccine despite cutting the funds for messenger RNA research. But all right.
And just a quick follow-up, Big E. With vaccines, is there a particular pneumonia vaccine to get, or is there one better than the other?
Consult with your doctor, because I know that we have, like for my dialysis unit, we have simplified it to one that actually gives the most coverage. But of course, when I'm talking about dialysis patients, my patients are immunocompromised. Most of them are over the age of 65. Even the ones who are not are in close proximity to people on MARTA buses. They're more likely to get it. So consult with your doctor about which pneumonia vaccine is best for you. Yeah. And at what age you even need to get the pneumonia vaccine, or at what age is recommended. Yeah.
Mm-hmm.
All right. And so we're going to keep moving, but I do want to do this for me. Put a lip emoji in the chat if you want me to talk about that side effect, that potentially life-threatening side effect from a commonly used blood pressure medication. I'm talking about the side effect that can make your lips swell up like a cartoon character or like AI. Put some lip emojis, and then as we get to the end, we'll do a scan and see how many lip emojis we have on if I talk about that side effect or not. All right. So now let's move into the weekly dose. Make sure you give us a like, please. Give us a follow. Let people know that we're here. It's a free way to support the channel. So, and also, of course, if you haven't subscribed, give us a subscribe, give us a follow on all platforms at Dr.Frita, because I give different information on different platforms. All right. So, D'Angelo. Shador, I'm not even playing. That one got me. In fact, Shador, you texted me like after work. You like, you see about D'Angelo? Yeah. So he was, oh my gosh, I got to talk about him in past tense, was a Grammy award-winning neo-soul R&B phenomenon. He was a soul writer. He was ahead of his time, and he passed away at the age of 51 from pancreatic cancer. I had no idea. He seems to have kept it pretty quiet. Let's play this clip, and then let's talk about pancreatic cancer.
He would go on to win 4 Grammys, and Rolling Stone ranks him number 75 on their list of greatest singers of all time. Michael Eugene Archer, his legal name, was born in Virginia, and famously shared his life for a time with soul singer Angie Stone, and the two of them have a son. She died in a freeway crash in March while on tour. The tributes tonight are far and wide. Singer and actress Beyonce writes that he changed and transformed rhythm and blues forever.
That was some sad news. And we talked about Angie Stone back when she passed away just in March. And so the two of them share a son. And so now he's lost both of his parents within a matter of months. And so, I'm praying for his healing and for, of course, all the loved ones of D'Angelo. So let's talk about pancreatic cancer, because it's not one of the ones that we talk about that much, Shador, because we don't have routine recommended screening. And that's because it's not super common like prostate cancer and breast cancer and colon cancer. It only occurs in about 3%. It accounts for about 3% of cancers. But if you're a part of that 3%, it's a big deal to you. The tricky thing about pancreatic cancer is that it oftentimes has no symptoms early on. So by the time you get symptoms, it's usually already far gone, possibly already spreading. But some of the symptoms that you can get from pancreatic cancer include jaundice, so like yellow of the whites of the eyes or the sclera, or yellow under the tongue, yellow hands, certainly yellow skin. You can get that. You can have pale stools, dark urine, okay? And this starts occurring when that pancreatic cancer causes blockage or obstruction in the digestive system. Unintentional weight loss. A lot of patients with pancreatic cancer will have abdominal bloating, abdominal pain, lose a lot of weight, nausea, vomiting. You can get hypercoagulability. And we talked about that, having a hypercoagulable state as far as having an increased risk for blood clots, thrombophilia. So if you're suddenly getting a bunch of blood clots and that's not anything you got before, that could be part of the syndrome of having pancreatic cancer. There's no one particular thing anyone does to get it. There are some risk factors or some associations with pancreatic cancer, such as having diabetes, having chronic pancreatitis, being a smoker can put you at risk for pancreatitis. Being exposed to certain chemicals, okay, like pesticides, can put you at risk for pancreatitis. And so, these are some of the things. You control what you can control, right? You can control smoking, right? And so y'all know I get on here all the time and say, please don't smoke cigarettes. Smoking cigarettes, I'm telling you, it's on the risk factor of just about every disease: heart disease, kidney cancer, lung cancer, skin cancer, pancreatic cancer. Okay, smoking is a risk factor for a whole lot of things. Also, you can control weight. Okay, living with obesity can put you at risk. Diabetes, you might not be able to totally control if you get diagnosed with diabetes. It could be, you can have a genetic predisposition, but certainly you can consult with your doctor and manage your diabetes. And the chronic pancreatitis, it can occur for different reasons, but one thing that can increase your risk for pancreatitis is excessive alcohol use. And so that's something that is controllable. And if it's an addiction, and we'll get into addiction before the day is over, addiction itself is a disease, but certainly you can seek medical help for that. And so, if y'all have any questions on pancreatic cancer, go ahead and put those in the chat and put pancreatic cancer or just put pancreas, and then we'll see if we have time to answer some questions. But rest in peace to D'Angelo. And I did do some short form content on pancreatic cancer. If you want to go and get a nice little kind of 3-minute sound bite of being able to share with others on signs and symptoms to look out for pancreatic cancer. But Shador, I was a fan of brown sugar, and it was a double entendre, right? Because he's talking about Mary Jane or marijuana, but he's also talking about brown sugar. And it was a very specific love song. And I remember, just being a young Black girl and how it made me feel. And then that song, How Does It Feel? Ooh, I didn't know he didn't like being a romantic symbol or an S symbol.
Yeah, I read up on that. I went and saw Anthony Hamilton Friday. They were good friends. He sung that song in honor of him. Mm-hmm.
I've seen him in concert once. That man bumping auto tune. He can sing, can he? He can sing down to the ground. Shador, that's a good concert. And they have that similar soul that that just sits there and moves you. All right, but D'Angelo will be missed. I know they ranked him 75 on Rolling Stone. he should have been higher than that. I don't give a doggone, and he came at a time there was lots of boy bands and other things, different cultural appropriation. I won't get into all of that, but he definitely ranks higher than that. He was one of a kind, D'Angelo. He was a true artist, and so he'll be missed. Yeah.
Absolutely.
All right. Go ahead and give us a like this video, share this video as we move to our next topic. This next topic, we're talking about measles. Y'all know I'm sick of it. There was an outbreak, and the reason I'm sick of it is because measles is a preventable illness that can cause people to pass away or to have complications. Let's play the clip, and then let's talk about this measles outbreak.
Bubbling up again and wreaking havoc on the school year. After exposure to the disease, health officials reporting more than 150 unvaccinated children between 2 schools in South Carolina have been forced out of the classroom and into quarantine for 3 weeks, the length of time it could take for symptoms like fever, a cough, or rash to emerge.
You have to then stay away from school for 3 weeks, which is going to hurt your ability to learn. That's just one of the many consequences, I think, of these kinds of outbreaks.
An outbreak has also been growing in the Minneapolis-St. Paul area, where 118 students are under quarantine, according to health officials. And a measles exposure temporarily closed a preschool, according to local reports in central Ohio. While one of the largest multi-state outbreaks of the year continues sweeping along the Arizona-Utah border, with more than 100 people diagnosed with the disease. It comes as an NBC News investigation found notable declines in childhood vaccination rates in 77% of counties and jurisdictions since 2019, including in St. Louis, Missouri, where the Pratt family is concerned about their 9-year-old who has an autoimmune disease.
One child or adult could cause an outbreak that she potentially would have life-threatening illnesses or complications from.
The CDC has confirmed more than 1,500 measles cases this year, the highest number since 1992. And while critics say there's been mixed messaging from the Trump administration around vaccines, with the president recently calling to break up the measles, mumps, and rubella shot into 3 totally separate shots, the CDC's published recommendations say the MMR vaccine is very safe and is effective, and there's no link between the MMR vaccine and autism.
As we enter the winter months, I suspect this is only going to get worse.
I'm telling y'all, this drives me bananas because it's preventable. And if you talk to people who were alive, especially if they were kids before 1957, almost everyone got the measles. We lost about 500 Americans from the measles, like they passed away each year. But we actually, because of the vaccine, eradicated it in the year 2000. Now we've had more cases this year than we've had in approximately 30 years. And so I want y'all to put in the chat, please, write measles in all caps if you have any questions about the timing, because these kids in Spartanburg, South Carolina, who are under quarantine, at least 153 kids are under quarantine for 21 days. So if you have any question about the timing of quarantine, or if you have any questions about how infectious measles is or about complications, write measles and write what your question is. Also, tell me what you think about these outbreaks. Do you think, for all these kids who are now no longer being vaccinated, is it no big deal? Does it concern you as a parent or as a community member? But just put measles in all caps if you have a comment or a question about the measles. Meanwhile, I'll give a little bit of information, but if we don't have a lot of questions, then we'll keep moving this train. All right. So as far as the measles, again, it's something that we once thought we eradicated here in the United States. Now we're having the outbreaks, and largely it's because people are not getting vaccinated and we have lost herd immunity. Okay. And you will recall, if you follow us, what herd immunity is. It's when the majority of the community, the population, the majority of the herd of people have immunity to an infection. When the majority are immune, then that protects even those who are unvaccinated or who are unable to get vaccinated. Okay. So you have some kids who have certain autoimmune diseases or who are very immunocompromised or who just cannot get the measles vaccine. They might be allergic to it. When you have the majority of the population vaccinated, then even the small percentage of people who aren't vaccinated are protected because most of the community, most of the herd is vaccinated. Well, we calculate that it takes about 95% of the population being vaccinated or immune to an illness in order to protect everyone else. And typically we've had, when kindergartners go into school, especially due to the vaccine mandates, we've had at least 95% vaccinated, which is how we've been able to, what we thought, eradicate measles. Well, now that number has dropped from 95% to 92.5%. And that's just a general number. In some areas where we've had the outbreaks, like in West Texas, for example, we have an even lower vaccination rate than that, which is what's making these people vulnerable. So yes, so now we've got the quarantine of the at least 153 school-age children, and they're being quarantined for 21 days in order to see if they actually are going to develop the measles, and they're being quarantined to keep them from other people, especially those who are unvaccinated. All right. So do we have any questions or comments on measles so far?
No. Yolanda just said measles for community and the elderly. That's her comment.
Yeah. Okay. So yeah, and elderly people, again, over the age of 65 are going to be at risk. The thing is, if you have had the measles before, then you are very likely to be protected. But as you get older, then your immunity can wane. And if you want to know if you are protected from measles, if you don't recall or know for sure if you've been vaccinated, or if you don't know for sure if you've had the illness, there are ways that we can test your blood to see if you have antibodies to protect you against the measles. You can consult with your doctor to find that out. Right. Anyone else making any measles?
I remember Rachel's question.
What's the question? Hi, Rachel.
Do you need to get an updated MMR vaccine if the last time you received it was in your young adult years?
Typically not. That's a really great question. If you get 2 doses of the measles vaccine, then that will give you a 97% protection against ever getting the measles for a lifetime. That being said, if you're someone who's had to go under chemotherapy, or if you're immunocompromised, or if you've had a transplant, or if you're just not sure, then you can still consult with your doctor about getting a blood test. If there's if your immune system is compromised, that's the only thing that might throw that off. But in general, if you're a pretty healthy person and you've had 2 doses of the measles vaccine, then 97% protection for a lifetime. Good question.
All right. And is there a booster? Yolanda was following up. Do you recommend to see if they have a booster?
Not typically. Not if you've had your 2 doses, or if you actually had the infection, and if you have no immunocompromise. If you're not immunocompromised. Yeah. All right. So here's the other thing about the measles that people I don't think they fully understand, because I always say, why aren't people afraid of a world without vaccines, or people are passing away? Same reason people aren't afraid of the boogeyman. They've never seen them. But I don't want to see it, because with measles, it's super, super contagious. It's so contagious. One person with the measles can pass it to 18 unvaccinated people. And if you're unvaccinated and you're exposed to the measles, you have a 9 out of 10 chance of getting the measles. Okay. It's highly infectious. And here's a real thing. Oh, I can't stand the measles. Let me tell you about this virus. If you are infected with the measles and you cough, you sneeze, you pass it with your droplets, and then you leave a room, that measles virus can live for 2 hours while you're gone. Okay. So if you're an unvaccinated person and you walk into an elevator, you can be in that elevator all by yourself and still pick up the measles if someone who was infected was in there within 2 hours. That's how serious it is. And it's not just a matter of a rash. Yes, you can get a high fever, spots in the mouth, a blotchy red rash that usually starts in the face. It can be on the chest, the back, the arms, the legs. But it's not just a matter of some type of a dermatologic imperfection. Measles can cause complications like encephalitis, okay, so inflammation of the coverings of your brain and spinal cord. It can cause a pneumonia, which can be fatal. It can cause ear infections, and it can cause you to not be alive, okay? So you see all these people saying, my body, my choice. I don't want, school mandates or vaccines. But mess around and find out. We've already had at least 2 children to pass away in Texas from the measles, something that's preventable. Do y'all think those are the last children who are going to pass away from it? Keep letting these outbreaks happen. I'm telling y'all, consult with your doctors. And despite this misinformation or even some political leanings, watch what people do. Don't just watch what they say. Case in point, RFK Jr. reportedly has had all of his vaccines, and so have his children. That came from the mouth of his first cousin, okay? JFK, President JFK's daughter shared that he's vaccinated, and so are all of his kids. President Trump is talking about this and that about measles vaccine. And we saw that it was just reported last week that he got his flu vaccine and his COVID vaccine. Watch what people with access and with privilege and with access to the highest information. Watch what they do, not just what they say. If you're someone listening and you're in a place like West Texas or Spartanburg and you're just, sitting there not getting vaccinated, look and see what your leaders are doing. Okay. This is for real. All right. Any more questions? If not, then we'll keep it going. We'll keep it going, Shador.
On IG, Baskets and More. Hello.
Baskets and More.
Yeah.
What's
Baskets
going
and
on
More.
there?
Are schools not requiring the vaccine any longer, the MMR?
Well, schools are requiring it for the most part, but it used to be very difficult to get exempt from it. Like you needed to have a real allergy or religious belief with all kinds of documentation. Now you can just pretty much say anything and they're really lax on it. And then when it comes to Florida specifically, we know that Governor DeSantis and the Florida Surgeon General, Dr. Latipo, has said that they are moving to ban school mandates. It hasn't happened as of yet, but they want to ban school mandates for vaccines, period. Okay. And so it looks like we could be moving in that direction, especially with the misinformation coming from the top, RFK Jr., who is the head of Health and Human Services. And a reminder, he's not a doctor. He's not an MD. He's not a DO. He's not a nurse. He's not a nurse practitioner. He's not a tech. He's nothing medical. He's not a scientist. He gives misinformation, but he expresses a lot of anti-vaccine rhetoric and, quite frankly, straight up misinformation, untruths. And so we're not there yet, but it's very easy now for people to not get vaccines. And again, we're seeing the level and the percentage of the uptake of the vaccine decreasing. And as it decreases with measles specifically, then the measles infection increases. Same thing with whooping cough. Okay. The pertussis vaccine is something that's been recommended and required over the years. In Louisiana specifically, we've had a severe decline in the amount of parents making a choice to get their kids vaccinated for whooping cough or pertussis. And we've had the highest cases of whooping cough, higher than we've seen in years. Okay. It's a correlation. Okay. And yes, children can pass away from whooping cough. Good question.
All right. Thank you, Dr. Frita.
All right. All right. Y'all go ahead and give us a like as we keep moving on this train. I thank to everyone who is participating. And I thank to all the new members that we're getting. And if you enjoy this format, enjoy getting medical information from me, again, join the members, click the link in link in my bio, or go to my one-stop shop, drfrita.com, and you can join the membership. Also, if you just want a one-on-one consultation with me, I do offer a telehealth concierge service where I get your history and I give you my medical information, and I can talk to you from all over the world. I've had patients from literally all over the world who come in. It's been a very successful event that we're doing, and I've really enjoyed being able to help people. Again, I'm a board certified nephrologist. I'm a board certified high blood pressure doctor, kidney doctor. I've also been board certified in internal medicine, pediatrics, obesity medicine. I stay up to date and I keep it evidence-based. And so you can come get a first opinion from me, a second opinion. And so, yeah, take advantage of that concierge service. All right. Let's talk about Selma Blair, shall we? We know that she is a wonderful actor. Do y'all know, to this day, my favorite movie that she's been in is Cruel Intentions. If y'all haven't seen Cruel Intentions, please do. She's so good in that movie. And also, this is kind of an odd fact, she was the audible voice when I was listening to the audible version of The Diary of Anne Frank. Anyway, I like her a great deal. She's been very open about her surviving with multiple sclerosis. She and Christina Applegate have a podcast together, but she shares something on how her symptoms, her signs and symptoms were overlooked when she was a teenager. So let's play that clip and let's talk about how sometimes, young girls are gaslit and their symptoms are overlooked.
So much time from work, my skin had fallen apart and my body and fatigue. And there did get a point where it's like, okay, I have to go back to work, this no matter what. And so I was searching on social media. Does anyone have a doctor that can give me maybe a steroid shot so I could deal with the pain so I'm not in pain? I thought I pinched a nerve and I'd be riding my horse and get whiplash all the time. I didn't know I wasn't strong enough to carry myself over the fences anymore. So it was easily missed. But I go to the doctor quite often saying, I can't stay awake. And he's like, oh, what mother can? I'm like, no, seriously. But I did. I put a plea out on social media with like kind of a here nor there, like x-ray of my spine saying, I don't know what to do. I want to get on a plane tomorrow. What can I do? And my old friend, Elizabeth Berkeley, she said, go see my brother. He's a spinal neurologist. And so I did, for the first time, saw a spinal neurologist, and he looked at my little MRI and said, yeah, you're getting older, but this doesn't seem like it would be something this severe that your leg's dragging. And then I fell asleep. And he said to my then boyfriend, does this happen all the time? Is she always? And he said, oh, yes. I think they put her on meds for depression, and she's probably make her tired. She's trying to go off them. And he said, no, there's something's wrong. So he stood me up and gave me a Romberg test, and then I just fell right backwards. I have no sense of where my body is in space.
Isn't that something? And you can always find an excuse, right? Oh yeah, you're just a mom, you're tired. Oh, your cycle's probably on. A lot of women are overlooked. So we're going to talk about multiple sclerosis, but I want to ask y'all a question in the chat, in IG, here on YouTube, where we have over 900,000 subscribers. Yay. On Facebook, Replay Crew, please. I want you to put Selma in all caps, SELMA in all caps. And I want you to answer this question. What is something that you can do if you feel like your medical symptoms are being overlooked? Okay. Give some advice on something someone can do if they know they're sick, they know their body, they keep being told, you're just tired, oh, you're just a mom, anything. What is something that you can do to advocate yourself if you feel like your medical symptoms are being overlooked? And if you have a personal story you'd like to share, please do. But meanwhile, let's talk about multiple sclerosis, okay? Because that is her diagnosis. And the thing about multiple sclerosis is that it can be so non-specific that it actually can be difficult to diagnose, especially if someone is not trying to hear it, okay? Because here's the thing. Most people who are diagnosed with multiple sclerosis are young, okay? You have young females between the ages of 20 and 40, and oftentimes they just look healthy, right? And so they're of menstruating age, of childbearing age, many are mothers. And so it's easy to say, oh yeah, that's just mommy brain, or oh yeah, you're just tired. And so these are the people who are getting overlooked, as what she's describing. She even shared one time when she was like in high school, she would go in with a headache with her mom, and the doctors would be like, oh, your menstrual cycle is probably coming on. And then she might see a boy from her same class going with a headache, and they're offering him an MRI, So, a lot of people are overlooked. We know we have health inequity, and we often talk about racial health inequities, but also a lot of women are overlooked as well and gaslit. But back to multiple sclerosis. Yeah, diagnosis usually occurs between ages of 20 and 40. And what it is it is a destruction of portions of the covering of the nerve cells in your brain and spinal cord. Okay. So you have your nerve cells in your brain and spinal cord, and it's important for them to connect properly so that you can see well, so that you can move well, so that your bowel moves well, so that your bladder moves well. Everything needs to be coordinated, right? From your brain and spinal cord to the rest of your body. But with multiple sclerosis, your immune system attacks the covering or the myelin sheath. It attacks the covering of these nerve cells. And so what happens is your body, what a wonderful body, it does try to heal. Okay. So once the myelin sheath, the covering has been attacked, your body tries to heal, but then you get scars to the myelin sheath, and you can get many scars. You can get multiple scars over the nerve coverings. And that's where multiple sclerosis comes from. Multiple sclerosis means many scars. Okay. So you have scarred coverings of your nerve cells, which then cause you to have an improper way that the nerve cells are functioning. And so then you can get weakness. You can have difficulty walking. You can be dragging your legs. You can have blurry vision or double vision. You can get bladder incontinence, bowel incontinence, fatigue. Okay. You just have a misfiring of your nervous system. And that's what in general happens when people have multiple sclerosis. There are treatments, you can have steroid treatment like corticosteroids, but we know that steroids have a lot of side effects. Yes, they can calm down the immune system, but they can also cause side effects like high blood pressure, water retention, weight gain, a suppressed or a pushed down immune system. So it can make you more susceptible to infection. You can get deep stretch marks or striae. You can gain weight specifically in your face, like get really round face or really big stomach and kind of thin muscles. All kinds of side effects can happen. You can have high blood sugar, increased risk for diabetes, but there are other treatments as well. Now we have some better treatments, some infusions that don't necessarily have all those side effects. Even plasmapheresis or plasma exchange. So there are lots of treatments, but first things first, it has to be diagnosed, and the treatments aren't perfect and not without side effects. Yeah. So it's really important to advocate for yourself. And that's why here we talk about different illnesses. And that's why I'm always just very excited when celebrities are transparent enough to share, because it shows you that, look, these illnesses, these disorders, these diseases, they don't care. They don't care about how much money you have. But at least if you have the knowledge is power, and you can advocate for yourself when you see your doctors. Did anyone say what are some ways that you can advocate for yourself if you feel like you're being gaslit, or if you feel like your medical symptoms are being overlit? Any suggestions for people?
Yes, so multiple people are saying second opinion. I remember Miss Patricia.
Thank you.
Laura, second opinion, advocate for yourself.
Absolutely.
Lemon agrees. Yolanda says be persistent and ask for labs and second opinion.
Good.
Queen Gina,
Hey,
get a second opinion or several and try to find a group to see your doctors, to see their doctors in that group.
Good. These are good suggestions. And I think second opinion is the overriding theme, because a lot of people are scared to get second opinions because they think that it's going to offend their doctor. It is your right. It is your right to get a second opinion. No one doctor is the know-it-all, the end-all. Okay. I have people who, a lot of people, Shador, will come to us for second opinions. I will look, I will be, black and white. I will be honest. And more times than not, I'll go through and I'll be like, oh yeah, this is why that doctor did this. This is why that doctor did that. I agree with this. More times than not, I agree with most of what the first opinion is. I might just explain it in a different way, or spend more time with the patient. And I'll be honest and I'll say, hey, I think your doctor's taking good care of you. Maybe just ask them to explain this more, explain that more, and I'll send them right back. I encourage patients with me because, Shador, I'm the bearer of bad news a lot of times. A lot of times people are seeing me because they got sent by their primary care and they have no idea that I'm going to tell them that they have an advanced stage of kidney disease and they might be approaching dialysis or needing a transplant. Nobody wants to hear that. And so sometimes they're like, I don't believe that. And I'm like, get a second opinion, and it is your right. It is your right. So don't be afraid of the second opinion. Don't be afraid of offending your doctor, because I'll tell you, any doctor worth her weight in gold or his weight in gold will have a confidence that if you know that you're doing what you're supposed to do, let them get a second opinion. They might end up liking the way someone said something, or maybe the other person sees something you don't see, but you have to have a certain humility if you're going to provide good patient care. So second opinion, speaking up for yourself. And by reading and by joining us, watching, programs like what we have, where we talk about different tests to ask for, okay, push for tests and say why. Say, you're saying it's just because I'm a mom and I'm tired, but I'm having blurry vision, I'm falling, I'm weak. Can you please do a head CT? Can you do a brain MRI? Can you do a spinal tap to check me for multiple sclerosis? So definitely, if you check out my videos here on the YouTube channel, again, I have hundreds of videos and I talk about the diagnostic tests for different diseases. Do not be ashamed to go in and ask your doctor. It's not you being presumptuous. It's not you trying to be the doctor. It's just you advocating for yourself or your loved one. Very good. Thank you.
Advocating. Rachel, I remember, she says, how do you go about getting another opinion when your health insurance keeps denying the procedure that needs to be done?
Oh my goodness. So that takes a lot of red tape and unfortunately a lot of kind of jumping over. So the second opinion in general, I would start there and I would call your insurance company. I would say, hey, what other providers are in my network? Okay. And so say it's a kidney doctor, find what other nephrologist. If it's a nerve doctor, find out a different neurologist. Ask and first go to that person. And so that kind of a second opinion for having the doctor is different from whether or not they're going to approve a procedure. But it's really going to take you having a doctor who's willing to advocate for you, because Shador knows we get denied day in and day out, and then we have to do pre-authorizations. For example, if there is a medication I want to give and they say, oh, don't start this one, start that one. I might already know based on my experience and my knowledge that the medication that I didn't prescribe in the first place, that happens to be the cheaper, inexpensive one, I already know that that's not likely going to work. But sometimes we have to jump through the tape, and I'll let my patient know every possible side effect, how we know if it's failed. And hey, if it works, great. But if it doesn't, we jump on it very quickly. And I'm back on the insurance company. Shador is calling. Sometimes I'm doing peer-to-peer doctor calls. So it's going to take you having a physician who's willing to advocate with you to have a procedure done. Now, if they're saying they're not going to cover the procedure, then it is your right to say, why aren't you going to cover for the procedure? What would make this procedure appropriate for me? Find out what their terms are, and then work with your doctor to see if indeed it is a procedure that is something that you believe is going to be helpful for you. And then working with your doctor as a team is what's going to help you. But unfortunately, these insurance companies, often it's their job to not pay, for things that are unnecessary. Unfortunately, that oftentimes crosses over, and they're denying tests that really are deemed to be necessary by the doctor. But good luck to you. Just keep advocating for yourself and find a team that has your back, where the doctor and the doctor's staff will work with you.
Right. Yeah. And Rachel, Laura noted, if you continue to be declined, report the insurance to the insurance commission in your state. Doctor is spot on with this advice for insurance. I've worked in the medical field for 49 years.
49 years. Ooh, bless your soul. Now that is great. Now say again, the insurance commission.
Yeah, contact the insurance commissioner in your state.
So that's good. So there is no one end all king or queen to the answers. There's always someone above someone's head. Thank you so much. Ooh, and thank you for joining and for sharing that. 49 years. Thank you for your service, because I already know what this healthcare field is like. Very good. All right. Shall we talk about Shonda Rimes? Listen, what's your favorite Shonda Rimes show? Mine is Scandal, so don't even play with me. Okay, I used to be sitting there watching Scandal like I was getting paid to do it. I know a lot of people like, was it Grey's Anatomy? If I ever heard one medicine or medical term mispronounced, it would just throw me and make me not be able to have that suspension of reality that I needed. So, but Scandal, I used to watch that thing like I was getting paid. All right, yeah, put your favorite Shonda Rhimes show. But let's talk about Shonda Rhimes, because there was a point where she said that she was going to be gone and passed away in 10 years. And then now she's talked about her health reset. So let's see what Shonda Rhimes is talking about.
Shonda Rhimes, the brilliant mind behind hits like Grey's Anatomy, Scandal, and Bridgerton, recently opened up about her past health struggles and a shocking revelation. She once feared she wouldn't live past her 50s. In a candid interview, the iconic showrunner admitted that her health had deteriorated to the point where she couldn't even lift her 20-pound child or play around like she wanted to. "I have little kids, guys, and I really thought I might be dead in 10 years, Rhimes shared. These words highlight not just her struggle, but the powerful wake-up call she received from her children. The realization that she might not be there for her kids pushed her to rethink her lifestyle entirely. Rhimes revealed that she struggled with her weight and overall fitness for years. Simple physical activities, which many of us take for granted, became exhausting for her. This struggle didn't just affect her physical health, but also her emotional well-being. Feeling like her life could be cut short at any moment became a turning point, motivating her to adopt a healthier lifestyle."
Awesome. So yeah, she shares a lot of things, including food addiction. And I'm actually going to talk about food addiction just real briefly. But meanwhile, I want y'all to put Scandal, just because that's my favorite one. Put Scandal in all caps in the chat and say, what is one activity that you can implement this week, that you're open to trying this week to improve your health? Just give me one activity that you're open to trying this week or continuing to do this week for your health. Put Scandal and then put that. So yeah, she's talked about food addiction, and I'm going to talk about it because I don't think a lot of people understand that there's a real thing, food addiction. You recognize that you can have substance addiction, and addiction is just any type of a behavior, doing something, eating something, having an activity that, even if it becomes detrimental to you, to your health, to your relationships, to your finances, even if it becomes detrimental, you just can't stop. Okay, that's addiction. And we recognize that you can have, substance abuse addictions like alcohol addiction, nicotine addiction. Yes, these are the most common ones. You can have certainly, opioid addiction, things of that nature, gambling addiction. You can also have food addiction. And everything is related to a reward pathway. Okay. So if something really great happens, okay, if I don't know, you do have a job well done and someone gives you a compliment, or if you've gone out and back in the day, you've hunted for your family and, everyone's happy with you and you brought home the meal, then you have a dopamine release. Okay. And the dopamine goes to your dopamine receptors in your brain. And it's just a really good euphoric feeling. Well, when you have a substance or even an activity, okay, like shopping, gambling, eating, what happens is that you get a dopamine release from these activities. So let's just take food, for example. You eat that chocolate cake or that lasagna, and you just might get really, really, this high dopamine release. It makes you feel really good, euphoric. And the dopamine receptors in your brain are like, ooh, yummy, yummy. Okay, good. Give us more. Well, you might keep eating different things that make you have that high dopamine release. But eventually your body is like, hold up, this is too much dopamine. And your body will cut back on your dopamine receptors and even cut back on the amount of dopamine that's released. So then what happens? Oh, you're like, oh, well, then I need one piece of cake used to do it. I better have two pieces of cake. I better have some cookies. You start doing more of the activity so that you up the dopamine release. And so then eventually, it's enough dopamine. You get that good feeling, but then your body again does a reset. And they're like, wait. Let's back off on the dopamine receptors. Let's cut back on the dopamine. And when this happens, it's called a tolerance. When your body cuts back on the euphoric feeling and you have to keep doing more and more of the activity to keep getting that euphoric feeling. So make sure, check out, I have a video right here on the Dr. Frita channel. If you put Dr. Frita addiction, then you'll see, I did it under Wendy Williams, talking about some of her addictions. And I really go through and I break down the reward pathway and dopamine release. Well, basically, Shonda Rimes has shared just how she really kind of had a food addiction. And I just want y'all to know that is a real thing. And so if you're struggling with something in your life, like online shopping, doom scrolling on social media, buying all kind of outfits at 3 a.m. and you just can't stop it. You might have a shopping addiction. I'm not talking to myself, but you might, and if you are going and you know that you're having financial issues, but you just can't stop gambling, or you can't stop going to Vegas or to Biloxi or doing whatever little gambling online games, it might not be, oh, you're just weak, oh, you need willpower. No, you could have an addiction. So consult with your doctor, consult with your mental health care professional, because it's a real thing. Having addiction is not just about drugs and alcohol. But I do commend Shonda Rimes for doing the reset, wanting to be here for herself and for her kids. I enjoyed the book. What was it? Year of the Yes. That's one of the books of hers that I read. But yeah, did anyone comment on something that they'll do to make themselves healthier? Oh, and do we have any lips in the chat? I know I'll say just a few seconds if we have any lips in the chat.
Yeah, we do have some lips in the chat, and we have some comments as well.
Okay. So we'll do a couple. So I'll just do a real brief angioedema talk, and I'll direct you on where you can get more information. We'll get a couple comments, and then we'll be out of town. So as far as angioedema, let's see, do you have the angioedema clip? A little bit of it. Okay, yeah. Let's play this clip. This is a very real side effect from a commonly prescribed medication, blood pressure medication.
You guys, so normally I would not do this, but I'm going to share my story because I don't want this to happen to anybody else, particular African Americans who are on high blood pressure medication. So about 2 o'clock this morning, I woke up out my sleep and I went into the bathroom. When I got in the bathroom and I cut the light on and looked in the mirror, half of my lip was like 2 to 3 times its normal size. So I'm like, oh my God, what is wrong with me? So first thing I'm thinking, I need some Benadryl. I don't have none, so I have to get in my car, drive to 7-Eleven at 2 o'clock in the morning to get some Benadryl. So I come back home, I take the Benadryl, I go back to sleep. I wake up at like 7:30 in the morning, go in the bathroom, look at my lip. Now my entire lip is like 3 times its normal size. So I get up, get my kids ready, get them off to school, drop my baby off to daycare. I go to a urgent care. So while I'm at urgent care, I made a post on Facebook just saying, y'all pray for me. If you my Facebook friend, you probably saw it. Saying y'all pray for me. I'm at the urgent care. My lip is swollen 3 times its size. Like, it's bad. Just so happened I'm in there, I'm talking to the nurse and then they checking me in. The doctor come in and see me. My friend called me, who is a nurse, because she saw my post on Facebook and just started asking me questions, basically the same questions that were being asked while I was in the urgent care.
And y'all, if you see her lips, they are swollen, swollen, swollen big. You can get more details on this because I actually did a short form video that really took off. It's on, if it's not on YouTube now, I'll make sure I have it on YouTube. But right now, for sure, it's on IG, it's on TikTok. You don't stop. It's on LinkedIn, where you'll see where I talk about the side effect. But let me just give y'all some of the points, because she mentioned some things. She talked about being an African American. So the what's causing the lips to swell is called angioedema, and that is an inflammation or swelling in mucous membranes, specifically in the lips, tongue, under the tongue, in the larynx, in the voice box. And it is a side effect. It's a reaction to a very popular group of blood pressure medications called ACE inhibitors. So ACE inhibitors include drugs like lisinopril, ramipril, benazepril. Yeah, you've heard these drugs. You might be taking them. Yeah, it can cause this. And so not only will it cause a huge lip swelling, tongue swelling, it can actually block your airway, cause you to not breathe, and make you pass away. Now, you're probably thinking, and I've gotten a lot of comments like, that's malpractice. Why would a doctor give you something like lisinopril if it can cause this? Well, because this side effect only happens in about 0.1 to 0.7% of the population. And so in the big picture, the benefits of these drugs like lisinopril, they can help with early diabetic kidney disease. They can help with heart disease. They are great for blood pressure. They'll help decrease protein in the urine. So they have a lot of great benefits. It's just that less than 1% of the population that can have this potentially life-threatening complication. So that's why it's not just taken off the market. It's so rare. But the thing that's really amazing is that it disproportionately affects Black people. This angioedema caused by ACE inhibitors disproportionately affects Black people. We're like 12 times as likely to get it when you compare us to other ethnic groups. And so I'll go into detail in my video about what exactly happens, but remember the word bradykinin. And if you're someone who's taken lisinopril before and you've had a cough, okay, I know somebody listening has had lisinopril. Put cough if you've ever taken lisinopril, benazepril, one of these ACE inhibitors, and you notice you had a cough with it. Well, if that's happened to you, then you may be at an increased risk for developing angioedema. Here's the scary thing. It's not one of those things that will happen as soon as you take the drug. Most people will develop angioedema from ACE inhibitors within the first few weeks of taking it, maybe within the first month. But you might not get the reaction until months later or even years after taking it. So even if you've been on lisinopril for 3 years and you're like, no, it's probably not that. No, it could be that. You could have a delayed reaction and be having the angioedema. So the most important thing is to stop the drug immediately and never take it again. Go to the ER, especially if you're having like swelling of, difficulty breathing, difficulty swallowing. But here's something. She talked about taking Benadryl, and I'm not recommending Benadryl, but I will tell you from a point of fact, because this angioedema from ACE inhibitors is not a typical allergic reaction, a lot of times the Benadryl or even steroids aren't going to work as well. I'm not saying don't take it, consult with your doctor, because you want to do something while you're on your way to the emergency room or trying to figure things out. But what will work for it, things like epinephrine or fresh frozen plasma. And if things get severe, you might even have to have a tracheostomy, like a hole put in your larynx or in your trachea. Yeah, a hole put in your trachea, that tube that connects your mouth or your pharynx to your lungs. And they might have to put a mechanical ventilator to it. And I've seen that because I've been consulted on patients who have had angioedema. I remember one patient, she was in the ICU, of course, her lips, her whole face swollen, and she was on a ventilator and she had a tracheostomy. I've had other patients like that as well, and some patients don't make it. So take it very seriously. If the lips start swelling, don't just sit and wonder, what should I do? Let me just take Benadryl and stay here. No, you call your doctor, you activate 911, because this angioedema can be life-threatening. I go in more details. Just check me out on my short form content on my other platforms. Follow me on all social media platforms, because I do post different information at different times. So as we slide out of the door, Shador, I'll just take a couple of questions. We'll prioritize members or anything that's really stands out to you, and then we'll keep the conversation going. Replay crew, everyone, let's keep the conversation going in the chat.
All right, this is from member Miss Rachel. She said, my mom passed away from walking pneumonia. Is there a difference between walking pneumonia and pneumonia?
So so walking pneumonia is a subtype. I'm sorry that happened to your mom. So they typically call it walking pneumonia if it's one of the milder pneumonias, like with mycoplasma pneumonia, even if you have a certain viral pneumonia, because the certain pneumonias tend not to make you as sick. Okay, you might be able to walk around, do all of your activities, not have extreme fever, not have extreme fatigue, but then they learn that you have pneumonia, and they'll call that walking pneumonia, as in you're pretty healthy. Clearly, though, if she unfortunately passed away, hers must have been pretty serious. But yes, walking pneumonia is a subtype of pneumonia, and all pneumonias are inflammation of the airways caused by some infection. Yeah, I'm sorry that happened to your mama.
All right, thank you. This is from Yolanda. Regarding the
pancreatic cancer.
Pancreatic cancer. Is it linked to the BRCA1 or 2 or PAL-B2?
Ooh, I'm glad that you said that, because having BRCA2 can put you at risk for it. Yes, I'm glad you brought that up. And so these genetic markers, BRCA1, BRCA2, PAL-B2, some of these genetic markers will have a cross increase as far as your risk for certain illnesses. Like we know for BRCA, it's not just breast cancer that can increase your risk for, although we do know that Matthew Knowles shared that he's BRCA positive, but if you have these genes, it can increase your risk for prostate cancer, for ovarian cancer, and even pancreatic cancer. It just depends. So when you have family members, let's just say you have a family member who has prostate cancer and you're born a woman, so you don't have a prostate, still stay tuned and, ask them questions, ask about genetic markers, because them having the prostate cancer could put you at an increased risk for ovarian cancer or for breast cancer. But yes, for pancreatic cancer, BRCA2 for sure can put you at an increased risk for it. Yeah, that was a good one.
All right. And staying in that same category, this is from TS.
Hi, TS.
Is there a specific lab test that can be screened for it or show up cancer issues in the blood? Can the pancreas be removed if cancerous?
Oh, that's a good question. So unless you have a very strong family history or some of these symptoms I mentioned, like the abdominal pain, bloating, jaundice, chronic or recurrent pancreatitis, we really don't offer a routine screening. So this would be a case of you really advocating yourself and asking for abdominal imaging, like abdominal ultrasound or abdominal MRI or abdominal CAT scan. Okay, something to look at the pancreas. But as far as the tests that can be done, there is a cancer marker that tends to be positive, and it's called CA19-9. Okay, so capital C, capital A, CA19-9. And if that's elevated, then that can correlate with having pancreatic cancer. But yeah, it's going to be a matter of consulting with your doctor, because unlike other cancers, unlike colon cancer, prostate cancer, breast cancer, where we have routine screenings, and even lung cancer, if you're at an increased risk for lung cancer, we just don't have it for pancreatic cancer. It only accounts for about 3% of cancers, but interestingly, and not in a good way, the amount of people who are passing away, it continues to rise. So right now, lung cancer is the number one cause of cancer death, but some studies project that pancreatic cancer will be the number one cause of cancer death in the next decade. Yeah.
All right. And then last question from Sheree regarding angioedema. Can the other ACE inhibitors cause the same problem?
Yes. Absolutely. It's all the categories. Lisinopril, thank you for asking that. Lisinopril happens to be a common one, but look, if your medicine ends in PRIL, or just if you're on any kind of blood pressure medicine, look and see what it is. Also, if you're on a combination medicine, it might have an ACE inhibitor in it, plus another thing like hydrochlorothiazide. And so you might not see that pril at the end of the name. So whatever, anyone who's on blood pressure medicine or have loved ones, just look it up. You can just kind of Google, go to Chat GPT and just say, hey, what's the category of this medication? So if it's lisinopril, ramipril, benazepril, if it's any ACE inhibitor, then it can cause it. And if you get this reaction, and the lip swelling does not have to be extreme. It could be a little bit of lip swelling, a little tickling in your throat. It still might be angioedema. And if that's the case, you stop the medicine immediately and you never go on it again. period. Okay. And again, if you're someone who's had a cough before from the ACE inhibitor, that means that you're reacting to bradykinin, and that could put you at increase. And just real quickly, what the ACE inhibitors do, like lisinopril, they stop you from breaking down a substance called bradykinin, and so then you get a buildup of bradykinin. Now, most of us are able to get rid of it through other pathways, but if you are genetically predisposed and you can't break that bradykinin down once the ACE inhibitor stops it, then you'll have an increased level of the bradykinin, and that's what stimulates the angioedema as a reaction to the blood pressure medication.
All right. One from IG, Dr. Frita.
Okay, hi.
This is from
IG.
Zayvon.
Hey, thank you. You've been participating real well today. Thank you. You come on to the front of the class. What's your question?
Is there a direct correlation between diabetes and pancreatic cancer?
There's an increased risk. I'll say that. So it's not a matter of if your hemoglobin A1C is 9 or 10, then you are definitely going to get it. It's not like that. But we do know that just in general, having diabetes can put you at increased risk for pancreatic cancer. Do we know the exact reason? No. But we do know that for diabetes, when you have diabetes, if it's so insulin, right? We know that your insulin is produced in your pancreas. So if you have diabetes due to some type of an autoimmune destruction of the cells that make the insulin, perhaps that puts you at an increased risk. If you have an insulin resistance or something that's going on with the biology of your pancreas causing you to have diabetes, we know that diabetes is directly related to the pancreas because the pancreas produces insulin. But as far as a direct, exact science to figuring out just how much at a high risk you are to get pancreatic cancer if you have diabetes, we don't have that down to an exact science, but just in general terms, we know that if you have diabetes, then that could put you at an increased risk for pancreatic cancer.
All right, thank you. And then 2 questions popped in for our members, Miss Rachel. Now I was thinking about this myself. Amlodipine, she said, what about amlodipine? That's a blood pressure medicine. Can it cause the angioedema?
Amlodipine has not been linked with angioedema. And now, I'm gonna tell you right now, I've been doing this long enough to never say never, but that is not one of the likely side effects of amlodipine. And it has a different mechanism, right? It's not going to be something that's blocking the degradation of bradykinin. It's not going to be something that's making that substance increase that causes it, okay? But what angioedema can do, what amlodipine can do, also called Norvasc, it can cause you to have a foot and an ankle swelling. Not with most people, but if it happens to you, you'll know it. If your shoes start getting tight, if you're leaving all these sock imprints and your legs are getting big, and you don't have big legs and this fake big legs, that could be from amlodipine. It can also cause swelling in your gums. It can cause constipation. So that whole group of medicines, calcium channel blockers. So that's amlodipine, Norvasc, nifedipine, Procardia. And there are other calcium channel blockers like diltiazem, cardizem, but really I mostly see it with like amlodipine and nifedipine. It doesn't happen to most people, but swelling of the legs, swelling of the gums, and even constipation. Yeah, but it's not classically associated with angioedema. That's the ACE inhibitors.
Thank you very much. And last but not least, Miss Patricia, member.
Hi.
I'm on a beta blocker, atenolol. I have a cough, not persistent, but it has increased over the last couple of years. Any link to the cough and medication?
Again, it's not a classic one as far as the atenolol. I will say this though, consult with your doctor because atenolol, it's a beta blocker just like metoprolol, and the atenolol is one of the older ones. Okay, we have some of the newer ones: metoprolol, Toprol XL, carvedilol. Bistolic is another one. So we have some newer generation beta blockers, but I will consult with your doctor still about that cough. Again, it's not something that's classically associated with atenolol, but something that can happen. Especially if you have asthma or COPD. Sometimes beta blockers can affect you as far as causing like a breathing issue or a shortness of breath. Very rare, but patients who are asthmatic, patients who have COPD, emphysema, sometimes these non-specific beta blockers can cause a problem with shortness of breath. So consult with your doctor and just kind of think about your own history. Do you have asthma? Do you have allergies? Do you have bronchitis? Okay. Because you could always have your doctor to stop the atenolol, try something different. And if in a couple of weeks you're getting better, then perhaps you are one of the ones. But yeah, it will be a different mechanism. and not as likely. But if you're noticing it and you really feel strong that there's a correlation, consult with your doctor, advocate for yourself as far as trying some other things. So we have a lot of other medications. Okay. And y'all make sure that you click the link in the description or go to drfrita.com to check out my book, Under Pressure, A Guide to Controlling High Blood Pressure. You know, I'm a board certified high blood pressure and kidney doctor. And I talk about, yes, these medicines that we're talking about. I also talk about how to lower blood pressure naturally. It's a real nice 360 view on blood pressure management. Yeah. Y'all are active today. Shoot. What's going on? All right. So if y'all haven't already, please make sure you give us a like. Please give us a share and keep following us, because every Monday we will be talking about celebrity health, all of the hot health topics in the headlines. No, we don't just do it to be nosy, but what we do is we bring out things that are already being talked about in the media and social media, and we make it positive and we learn from it in an evidence-based manner to help you to have a healthier, happier life. All right. So thank you, Shador, for being my wonderful co-host and office manager. I thank you to everyone who participated. A special thank you to all of my members. I appreciate you for joining. Thank you for IG. Y'all were in the house today. Facebook, replay crew. I see you. Let's keep this conversation going in the comments, especially what you're going to do to make your life healthier. What's the one thing you're open to doing? Because when you make these suggestions, that helps other people. Also, I appreciate how y'all have made these comments about ways to advocate for yourself, asking for second opinions. Keep putting that in the chat. I'm telling you, when people come back and look at this, it's going to help them. But I want y'all to please make sure you have a wonderful, happy, healthy week. And I thank you for making Monday your healthiest day of the week.